Dr. Sulfi, what's your opinion about this? Even as the WHO downplays all of this, are you okay with the kind of level of alarm that we've been seeing over the headlines, over how people are talking about it, given the last 3-4 days? Are we overreacting to all of this because of the COVID-19 trauma, or are we underestimating how quickly the next outbreak can actually spread? After COVID, there was public anxiety around viruses. It still remains. It's extremely high. How will you as a doctor balance that awareness without triggering unnecessary panic? If I could give the baton to you.
Yeah, I think it's significant that we always keep a watch on any outbreak. That is actually good. But at this moment, for this hantavirus infection, I think actually that the history of this disease for the last 30 years plus is which shows that it is a very, very self-limiting. If I can say that, if it may be a self-limiting illness, and maybe will not cause rapid spread like COVID-19 or any other illness, maybe some influenza infection and all. But it is never going to be like a COVID infection, and the fatality rate is also not unless and until it is the renal and the pulmonary and the cardiovascular system is affected, which will not be very, very serious. So I think we can justify in the approach of the World Health Organization, which says that at the moment there is nothing to worry, and the long incubation period.
But Dr. Sulfi, last time back in 2020, that's exactly what the WHO had said initially as well. There's nothing to worry about, and the mutation aspect and factor. I'm going to come across to the other doctors as well. But what, according to you, is the mutational, burden and overload here? Because we had the Omicron variant. We had the Delta variant of COVID-19, all of those different variants that kept on changing and, kept on mutating. Is that the similar scenario here?
No, but fortunately, see, regarding the COVID-19, we were not at all aware about that virus. The mutation part we were observing, and we could find out a lot of mutations. But fortunately, this virus is known to the world for maybe many decades, and the possibility of mutation is still there, but I think it may not be that significant if you look into the history of this virus.
Dr. Sulfi, when it comes to becoming a benchmark of how to tackle COVID-19, I think Kerala was the state that really set the standard for the entire country to follow. India's healthcare system, let's throw some light on that, on our preparedness. It has evolved enormously since the COVID-19 pandemic outbreak. If a suspected hantavirus case emerged, let's say tomorrow, are we realistically better prepared now in terms of testing capability, our surveillance at these ports and airports, isolation systems, the genomic tracking? Where do we stand right now today? You're confident and comfortable on that front?
You're asking me?
Yeah.
Actually, yeah. I think in a way, that's actually maybe that question may not, that situation may not arise as a, that is what I think. It will not be a big outbreak in India or any other country. But having said that, I will say that if you look at any other scenario, maybe not this hantavirus or maybe any other fresh infection, we are better prepared after this COVID experience. I will say that the entire world is better prepared. Many countries are better prepared. Kerala is better prepared. India is better prepared because we have the experience, our scientific community as well as the infrastructure and the supporting staff. Everyone is better prepared than the COVID era. So I think at the moment there is nothing to worry. If at all there is a big
But then, Dr. Sulfi, the WHO says more cases may still emerge because the incubation period can stretch up to 6 weeks. Does that make containment more difficult across the world, not just about India?
No, yeah, it's 6 weeks incubation period is definitely a challenge because a lot of patients they might have got that infection and that will come out. But then I think it's a closed group at the moment. It's a closed group and it will not spread. Man-to-man spread is very rare. Man-to-man spread in this hantavirus is very, very rare. And so I think it will not spread like that. If only thing is we'll have to observe all those patients, all those people for the next 6 weeks, and maybe the incubation period is over, or maybe the surveillance period is over. We'll have to look at watch those patients very meticulously. That is all what we need to do. There is nothing to that. The bottom line is it's not going to be a public health problem in the entire world.
Okay.
There is no question of panic at the moment.